My name is Stuart Porter. I'm a lecturer in physiotherapy at the University of Salford and I'm part of the ICPP team. I've just got this presentation for you with some added commentary about communication and I hope that you find it useful. On this slide here you've got some information about how to contact me if you ever want to chat through things. So the first thing to do is to think about what communication is and why it's so important. In its most basic form, communication is delivering one message from one thing or person to another thing or a person. And obviously the career that you've chosen, that's paramount. Communication is obviously a very huge subject, so we need to break it down into some specific components. So what we're going to talk about are the components of good communication, what makes good communication, and then talk about why it might be difficult to communicate at some point in your career as a healthcare professional. I think it's human nature to take things for granted, and certainly with communication, we take it for granted that we do communicate effectively. As an educator, I like to think that I'm reasonably good at communicating, but there are a lot of occasions in my career where I've not communicated effectively, and it's only when things go wrong that we realise that communication is so important. When I first started to think about preparing this lecture, the first thing I did was to look at the first signs of human communication, and I came up with this cave painting from about 20,000 years ago, which just shows you that even back then we were trying to communicate across time. This chap's showing you how good a hunter he is, and he obviously wants to communicate that fact to you, which I thought was interesting. So one of my interests is outer space and astronomy, and I just thought I'd start with this. And this kind of illustrates how important communication is to the human race. One of the first space probes that we ever sent out of the solar system was the Voyager 1 and Voyager 2 space probes. One of the first things that we did was we attached an LP, basically a record, that's got information about the planet Earth, people speaking, photographs of people playing, children, flowers, music, and it just shows you that in a multi-billion pound space probe, we still want to reach out and communicate to people, and it's extremely important that we send our message out to other people. Whether or not anybody will ever hear the record is doubtful, but we tried. You don't need me to tell you that the way that we communicate now over the past 10, 15, 20 years has changed radically. Um, Facebook, Twitter, Instagram, emails, in theory, a great development, but not always as smooth as we might think. I'm sure that you will be told in your respective professions about the dangers of using social media as a healthcare professional, but obviously there are great advantages to that as well. We've got virtual medical consultations, for example, that are very valuable if someone's in a remote area. It's always tempted to think that we are great communicators, and I think on the whole, people in healthcare are good communicators. But there are occasions where we get this wrong. I can think of quite a few from my career. For example, when I started my PhD, one of the first things I did was I went to interview people with a very specific spinal disease, and I thought I was doing a great interview, communicating very well. And on the first interview, I forgot to put the batteries in the dictaphone. And on the second interview, I put the dictaphone up next to a parrot in a cage. And the only communication that I picked up from the patient was the parrot squawking for an hour and a half. So it was a valuable lesson, but we always get communication wrong when we least expect it. I think the problem with a lot of the stuff that we do on this interprofessional module is that it is kind of common sense, but it's also extremely important. So I just thought it was worth just highlighting some of the specific outcomes that you will benefit from having good communication skills. A lot of research now says that your patients will respond better to you if you communicate well with them. Also, you're less likely to be complained about or sued, even if you do something not quite right, if you communicate well. And the bottom line is it makes you happier with your job and gets you more job satisfaction. And certainly, I think you're appreciated more by your patients. If you think about when you go to the GP, you're not really concerned about what degree he or she got or where they got it from. What you want is someone that can listen to you and interact with you and communicate with you. So we can't get away from how important this communication thing is. I've just listed some of the specific medical improvements here that come from good communication. Some of them rather surprising, really. So it's been shown that chronic headaches resolve quicker if patients are communicated with appropriately and given the right amount of information. Blood sugar is better controlled if people understand what's being said to them. Blood pressure in chronic hypertensive patients is lowered. Reduced pain in people with cancer. Increased lung capacity in people with asthma. Generally lower stress hormones. Generally speaking, it's good to give information to patients, although there are exceptions. And perhaps most importantly, it allows the patients to make more realistic decisions and assumptions about their treatment if they are, for example, debating whether to undergo chemotherapy, radiotherapy, that kind of thing. When you discuss and look at the reasons that healthcare professionals are complained about or struck off even, very often there is a root of failure to communicate things. And certainly some of the recent medical scandals, Harold Shipman, for example, there was a failure of other people to communicate with each other about what was going on, which directly led to people dying. So there's a serious point to this. It does protect you as a professional and protects the public, more importantly. And if nothing else, you want to be happy and respected in your job. I think being able to communicate with people is a great joy. It's very difficult, and sometimes we do get it wrong. I think the hard thing about being a healthcare professional is knowing how to adapt your communication. So you may have patients ranging from babies who can't communicate at all, to young people who kind of half understand, to professionals who understand probably more about the subject than you do, all the way through to people who are terminally ill or ventilated and cannot respond. And it takes a lot of skill to adapt your communication to each client group, but it comes with practice. So we're going to talk now about the different components of what makes up good communication. The figures vary, but most of what we communicate is non-verbal. It's not just what we say, so it can range from, as we've got here, facial expressions, the tone of voice that we use, how we stand, sit or move, how we dress, the eye contact that we make with people, the gestures that we make and the posture. So I look after the new first year physiotherapy students, and I always feel slightly like your dad trying to tell you to cut your nails and dress properly and iron your tunic, but it does matter. It kind of shouldn't in a way, but it does make a difference. If you think of yourself as a person on intensive care whose daughter or son is very ill, and the therapist walks up and looks like they have an attitude and is chewing gum and has a dirty tunic, it doesn't matter how good that healthcare professional is, you will form a judgment very quickly about that person, which may be wrong, but people make snap decisions about people. So don't forget that it's not only what we say, it's the other peripheral aspects of communication as well that are as important. This slide is kind of a summary of what we've just said, but just have a quick look at that, because when you go on clinical placement, one of the things you'll be judged and scored on is your professionalism and your demeanour with the patients. Again, not really related to how intelligent you are, but more of a personality perception thing, really. The bottom line is that with our patients, although we need to maintain a professional boundary, it's about building a relationship with the patient. Quite often the patients that we see will come back to us multiple times, and quite often we're expecting them to change their behavior. Patients are like us, they've got busy lives, they've got things to do, they've got better reasons to not do their exercises or not take the tablets. Part of communication is about building a relationship with your patients. One of the most important things is empathy, which you'll come across quite a lot. Just as an example, my father passed away about 4 years ago, and he was on the ward that I used to work on, which was interesting because I saw my former colleagues in a different light. And the most important thing was the way that they were with my dad, the fact that they understood that he was having a bad day, the fact that they understood that he didn't want to get out of bed and walk. Things that you don't really realize until you're on the receiving end. Okay, so I know this quote's a little bit cheesy, but I think it's useful. It's always worth trying to remember this. People want to know that you care about them. Yes, it's cheesy, but it is important. And certainly in my profession in physiotherapy, we're quite often expecting patients to do things they don't want to do. They don't want to exercise. They don't want to do the things that we ask them to do because they're painful. So if we want to get buy-in from the patient, and this applies to all professions, not just physios, we need to try and push the right buttons with our patients, basically. When you first go on clinical placement, and this is understandable, but you'll be very worried about medical knowledge and getting it right and doing the techniques in the right way and listening to what factual information the patient gives you or recording patient notes. Don't forget, it's also important how the patient says things. You can quite often pick up things in the way that a patient delivers something or says something that is not verbal. One of the important things that you'll come over again and again over the next 3 or 4 years is reflective practice. And it's not really possible to be reflective unless you stop and think about what the patient's saying or what your colleagues are saying. So I've just, probably for the first time here, shown you a very simple reflective loop where you come up with some kind of question, you test to see whether that's true, and you get some feedback. And that involves listening to your patients as well. I think it's important that I am realistic about this. There are barriers to communication, too numerous to listen here, but there are always going to be people or activities that you find difficult to communicate to patients. One thing I would say is that when you do graduate and you become specialized and you start to work your way up through the higher bands, it becomes easier in a way because you get very good at explaining your area to a patient. Don't beat yourself up too much. It is very hard as a student because we expect you to be good at 50 different things, and that's a big ask really. So don't beat yourself up too much. Also, don't forget that there are some patients or clients, whatever you want to call them, who are very difficult to communicate with, and it may be that you need help. It may be that you need an interpreter. It may be that you need a relative. It may be that you need a signer. It's not always your fault. I think it's also difficult to sometimes let yourself go and think about what emotions the patients are going through. Um, One of the things that you'll probably be scored on your clinical documents is the ability to separate your personal from your professional life. But that can also be difficult because we're all humans as well and we go through the same emotions that our patients do. So there's a temptation sometimes to become a little bit robotic in the way that we speak to our patients. And I understand that, and I've probably done that myself in my own career. And I think it's a way of coping with stress and heavy workloads. It gets easier once you become more confident in the realm that you're working in. You know as well as I that the NHS is a busy place to work in, and quite often you are expected to get through fairly large volumes of work, and there are always people checking up on you. How many patients are you seeing in an hour? Have you seen the heart attack in room 6? We tend to eventually dehumanize patients, not intentionally, but we do it as a means of getting through the day. Always bear in mind that there's a person at the end of the heart attack in room 6. For this one, I'll just use some of my own examples. When I'm tired, I don't communicate very well. I tend to just grunt at people. When I'm hungry, I shut down completely and don't want to speak to anybody. And if I'm in pain, I want to be left alone. So those three things will also affect your patients as well. When we are anxious, we tend to want to get our work done and not listen to the patient. That can be a problem. We sometimes fear that we're going to be overwhelmed. We mentioned that in the last slide. And also, you will come across patients or clients that it's very difficult to help them. And that's quite traumatic. If you go into a profession where you want to help people by definition and you can't help them, it's very difficult to take that sometimes. And that can sometimes cause frustration. And it makes us more aware of our own morbidity and mortality, really. Every time I go to visit students on placements, there's a new piece of equipment or a new database or a new computer system, which is a great innovation, as you know. But often that causes stress to the people on the shop floor as well. So just bear in mind that you will have a lot of pressures on you that will affect your ability to communicate with each other and with your patients. If possible, always think about what the other patient's going through or what your colleagues are going through. I think people are very good at thinking about what the patient's going through or the client's going through, but sometimes we forget how busy our colleagues are as well. And that can cause frustration as well. So don't forget you are part of a huge team. Probably most of the people, as you are now as students, you've all got the same stresses and worries. People tend to have a lot of commonality in what they are stressed about. Another cheesy quote, but I think it's an important one. Certainly here at the university where I work, the colleagues that I work with are absolutely fabulous. They will do anything to help you. And I think that's the same for most people. You have to assume that most people will help you. So if you ask for help, you will usually get that help. There's always somebody else that you can talk to. Some people just don't have empathy, and you will come across patients that don't have empathy for each other and for you. And you will come across colleagues who don't have much empathy as well. I think it's unusual in healthcare because usually we weed them out at interview, but this is an example of a sweet little lady who actually murdered 9 people who looks like the nicest lady in the world. So you will come across people who have no empathy whatsoever. I just thought this was interesting. If you feed glucose to a serial killer or a sociopath and then strap them up to a monitor and show them photographs of horrific things or upsetting things like children crying or puppies not being fed or a million things you can think of that are horrible, a normal person will get very emotionally involved with that and get upset. Some people will not. So the murderer on the right, you can see the lack of activity in the brain cells, especially in the frontal lobe. Some people will not have empathy. And unfortunately, you're going to have to get used to working with people sometimes who don't have empathy for what you're going through. Just please try not to be one of them. So just by way of a summary, about halfway through the presentation now, always try and listen with both ears to the factual and the emotive responses that people are giving to you. Reflect what you're hearing from your patients. Say to the patient, I think you seem to be quite down today. Is that right? It's always useful to bounce things back to the patient and let them know that you care about things. Quite often the patients that you see will have chronic diseases. I'm sure you'll learn over the course of this module about the causes of disease and what the common diseases are. And the demographic has changed massively. So whereas in the past people were likely to die rather suddenly from an infection, now people are just sick for a lot longer, for decades. So you will have a lot of people with chronic, I hate to use the word incurable, but uncurable diseases which we can manage. And quite often the ability to communicate about a disease or a condition to a patient is well over half of the battle. So we always have the debate, can you learn how to communicate or is it something that you're actually born with? I think like most things in life, it's probably a combination. I think some people are naturally good communicators and some people can just develop the skill as they go on. And like we said before, if you're doing the same job for many years, it becomes a lot easier to appear to be more relaxed and competent at what you're doing. You will still get it wrong, but it does get easier. So let's move on to talk about some of the barriers of communication now. So we've already talked about the need for a relationship of some form between you and your patient or the patient's relative, and empathy is a key component of that. There are various skill sets involved in communication. There are content skills, which is what you say, and then there are process skills, which is how you say it. Probably early on in your career, you will focus on the content skills, getting the words right, pronouncing the words right, getting the factual content right. And then gradually, I think what will happen just by natural osmosis as you surround yourself with other professionals of a similar ability, you'll pick up tips and hints from them and you'll develop your process skills. But always be aware of how you come across. It's horrible, but it might even be worth videoing yourself doing a mock assessment with a patient. It's quite stressful, but you certainly pick up things that you would never have thought that you actually did. One of the things that helped me most of all, I did a mock interview with my old boss before I got the lecturing job, and apparently I scratched my ear an awful lot. So what my boss said to me was, just move your big toe inside your shoe instead, and that takes away the need to scratch your ear. And when you're being interviewed, you look like you're completely calm because nobody can see your big toe going up and down like crazy. It sounds silly, but it certainly helped. When we are communicating with patients, it's very easy to assume that we've just got the point across to the patient. That's not always the case, and there's a lot of research that says that patients remember a very small amount of what we tell them, something like 10%. So it's sometimes worth just thinking about meta-communication. That means communicating about communicating. And I've just listed some examples here. So partway through, if the patient appears to be confused, or even if they don't appear to be confused, just stop and say, is that okay? Do you follow me? I'm not sure you understand what I'm saying. It's very difficult to do this without sounding patronizing, but I think you'll find a way to do that. And very often that will highlight areas where patients don't understand what you're asking of them. This leads on to the concept of inviting feedback from people. So it's quite common to get surveys done and reflective reports based on your communication. We do that in physiotherapy. It's useful because it shows the client that you actually care what they think of you, and that you've taken the time to pursue any concerns, and that you can be honest, and that they really care, you really care how they feel. Another way that we can divide our questioning when we're talking to patients is via either closed or open questions. One's not better than the other, they're just different. So there are occasions where it's better to ask a closed question when you want a very specific answer, and there are occasions when you need to let the patient or the client talk for longer. So obviously a closed question can be answered with one word or a very specific piece of information. Um, the problem with those is that they can appear to be quite abrupt, but they do have their uses. And then if we want the client to tell us more, and if we give clients long enough, they will usually describe the symptoms very well and the problems very well. In that situation, we tend to go for an open question. Just listed some common advantages and disadvantages of closed questions here. Obviously, a closed question is quick and easy for all parties concerned. It's also easier for us to analyze answers if they're yes, no. People are more likely to give you a one-word answer if it's a sensitive topic, maybe. And also some clients who aren't quite as articulate may be able to give you simpler answers. The disadvantage is that they can start people thinking about things that they've never thought about. Clients who don't know the answer may try to help you by kind of just saying yes or no, when actually a dichotomous yes or no is too simplistic. Sometimes things aren't simply yes and no. That might lead to frustration in your client because the answer that they give is not answering what they want to tell you. The wrong answer might result, and it might be oversimplistic, and it may just make people make choices that they wouldn't normally make. Like, are you in pain? Well, pain's not a black and white thing. Clients may be in pain sometimes more than others. Kind of the reverse from that is with open questions. We do have some advantages in that they can take you off in a direction which allows you to investigate other issues. It will allow people to answer in detail and in their own way. You might get answers that you weren't expecting, which can be useful if you're doing research, for example. It might allow the person to answer a relatively complex issue, like a social situation. It can inspire people to be more creative with their answers, not always, but sometimes. And it allows people to think about their answer in their own way and puts them in control of their answer. And people might feel more comfortable if it's not a plain yes, no answer. The different disadvantages of those is that people are different in their ability or willingness to communicate complex information with you. You may, as a result, lose the answers that the people give you. It might be difficult to make sense of what's going on, particularly if you're trying to do some research, for example. People who are more articulate and perhaps used to speaking about things may have an advantage over people who aren't. And it can take a lot of time and effort to phrase the question and get the answer appropriately. I think the key thing to do is to recognize that both are valuable. So there are occasions when you need to ask a patient a yes/no question, and then there are occasions when you want the patient to be able to expand. Ironically, one of the most powerful communication tools that we have is to not say anything and just listen. I think the world that we live in now, we all want quick fix answers and things done very quickly and in real time. And sometimes we need to give people time to process information. And certainly from my own research career, when I was doing my PhD interviews, one of the criticisms that my supervisor gave me, and she was absolutely correct, was that I didn't wait for people to answer the question fully and I jumped into the next question too quickly. And listening back to my interviews, because they were all recorded and transcribed, she was absolutely right. So sometimes it's useful to just let the person talk. Not always as easy to do in real world because we've got pressures. Please try to think about body language, about your own body language and that of a client. Just be aware that sometimes what you might perceive to be aggressive body language is actually not. So for example, if a client comes to see you and they have their arms folded, it could be perceived as a slightly defensive or aggressive gesture, but actually it might be that they have a broken elbow and the only way they can get relief from the pain is to cradle one arm in the other. Similarly, if you have a client who has back pain, you ask them to sit down and they say, no, I'd rather stand. That's because it probably hurts them more to sit down than to stand. So just bear in mind that there may be a physical reason for an apparent body language mismatch. You may not realize this, but when a lecturer is at the front of the class watching, we pick up very sensitively on body language and perceived body language. And just be aware that we notice cues from the audience. So I've just got 4 different pictures of a young woman here adopting different postures. So I suppose going from left to right, she's bored. Second one is chicken or fish for tea. Third one is thinking about something else in the future. And fourth is the one that is most interested. But again, I can think of examples where that can be misinterpreted. One of the stories that I often tell my students is that when I very first started lecturing, I had a student who had a severe hearing impairment. He couldn't hear at all. And he lip read. And I didn't know this. And he used to sit on the front row of every lecture, but he always looked like he was absolutely fed up. He looked like the girl on the left in this photograph. And after a few days, I think he noticed me noticing him, and he came to me and he said, Stuart, please don't think I'm being rude. I know I look like I'm disinterested, but the reason is I'm actually reading your lips. And when I read your lips, I'm focusing so hard on reading your lips, I lose any emotion in my face and I look like I'm fed up. And that was very powerful because once I knew that, I was okay with it, but I jumped to the wrong conclusion. I just thought that this student wasn't interested, which could not have been further from the truth. He was a very good student. So just bear that in mind. So I've come to the end now. Just got a few little tests for you. There is a test that's going to be generated in association with this PowerPoint that you can have a go at. But I've just got a few different pictures here to show you the range of different emotions communicated by people without actually speaking. So these are a couple of pictures of yours truly in action. Just reminds me it's time to lose a bit of weight, Stuart, really. But the first one is me basically saying to the student, sit down, and using a hand gesture. That could be interpreted as being quite good communication or poor communication. I suppose it depends how you do it. And then the second one, I can't remember what I was doing. Somebody took a photograph of me, but it could appear that I'm trying to be defensive and push the audience away, which is not my intention, I'm sure. But just bear in mind that people will watch you very carefully, and it's quite a daunting thought. But as a healthcare professional, you will be watched very carefully by everybody. So just try and bear that in mind. This is a group of Chinese medical students that I'm fortunate enough to lecture at Cambridge every summer, and this was their first day at university after being on a plane for 15 hours, and it's not difficult to work out how excited they are, so you can see joy there. Followed very quickly by relief. You can see that they're much more relaxed and they've arrived and everything's fine. Here's the kind of communication that lecturers love to see in students: respect. Everyone's making good eye contact, everyone's listening. But here again, I've fallen foul of getting it wrong quite often with a group of international students like this. When I first started teaching them, they were very, very quiet, but that was the culture. That was the way that they were taught to communicate or not communicate with their lecturers. Once they realized that it was a much more interactive style, they were absolutely great. And the other thing that I fell foul of was that I thought that some of them were just on their mobile phones texting each other, and they actually weren't. They were actually translating in real time what I was saying back into Mandarin Chinese. So again, I've got it wrong on occasion. So that brings this presentation on communication to an end. I hope you found it useful. If you would like to give me any suggestions, my office is on the 7th floor in the Alton building. I lecture in the physiotherapy program, and I hope that you enjoy your studies. I'd just like to finish by saying that I've lectured at Salford for 22 years now, and the staff that you are with are some of the most talented, capable staff that you could ever wish to work with. And again, I know I'm ending on a bit of cheesiness, but it is heartfelt. They are absolutely brilliant, and I hope that you enjoy your chosen career.